To keep it interesting, let me shift to a different topic. Perhaps let's go with the two A categories. We did one from ethics. Let me pick one from abnormal psychology, the other A category. A categories, in case you haven't picked this up prior, that means the most frequent categories on the exam, abnormal and ethics, are the two A categories on the EPPP consistently. So let me present, again, a test question. I'll read it, so to speak, twice. I'll give you 4 options twice. And so you can kind of sit at home and see how you would process this very same information. Okay. According to the DSM-IV TR, and I just want to parenthetically tell colleagues, it won't be until probably the summer of 2014 that the DSM-V will make its appearance on the EPPP. So let me come back and say, according to the DSM-IV TR, which of the following is a requirement for the diagnosis of separation anxiety disorder? Again, the test question. According to the DSM-IV TR, which of the following is a requirement for the diagnosis of separation anxiety disorder? Here comes choices A through D. A, onset of the symptoms prior to age 7. Onset of the symptoms prior to age 7. B, duration of the symptoms for at least 2.5 weeks. Duration of the symptoms for at least 2.5 weeks. C, significant distress or impaired functioning as a consequence of the symptoms. Significant distress or impaired functioning as a consequence of the symptoms. D, persistent and excessive concern of harm befalling a caretaker. Persistent and excessive concern of harm befalling a caretaker. So my hope is that you've captured A through D. I tried to say them both twice, the choices twice. Here's the protocol analysis. This is an abnormal question. As I look at the test question, there is a very important concept or question that is presented to me. It's the word, really, requirement. It's going to shape my answer. The word requirement in that test question will shape my answer because now I have to find something that is in fact a requirement, not just a choice in a polythetic listing, which is what the DSM-IV or the TR is all about. So let me say that when I go to A, a question that I might ask myself, even before the content of age of onset prior to age 7, would be this question: can an age of onset be a requirement for the DSM-IV TR? And the answer is absolutely. So A is a potential viable answer. However, age of onset prior to age 7 is ADHD, as most colleagues will be quite familiar with, and it is not an age of onset for separation anxiety disorder, which is just simply an age of onset prior to age 18, as most or a large number of diagnoses in that DSM, in that section entitled Diagnoses Usually First Evident in Infancy, Childhood, and Adolescence. So consistent with that, age of onset prior to age 18 would have been correct. A could have been correct if they gave us the right age. They did not. A's out. B, duration. The question I'd say is, can a duration be a requirement? So I'm interfacing it with the test question. Well, duration definitely could be a requirement. The great majority, almost all the diagnoses have requirements of numbers of symptoms and length of symptoms. Maybe a lesser known piece of information would be separation anxiety disorder, but there are no half weeks in the DSM-IV or the DSM-IV TR, so you can throw this answer out. 2.5 weeks is incorrect. It could have been correct, by the way, if it said 4 weeks. That's what the DSM-4 TR says about separation anxiety disorder. So in some ways, the good news is A and B both could have been correct, and they're both clearly and absolutely incorrect. Let's go down to C and D. Significant distress or impaired functioning as a consequence of the symptom. Well, that's generically true for the entire DSM. The DSM says, whether it's the 4 or the TR, that in order for us to label something psychopathology with a label of psychopathology, there must be significant distress or impaired functioning as a consequence of those symptoms. So hold C. C has absolutely some attraction to it because it may be the right answer. Let's compare it to D. Significant distress or impaired functioning as a consequence of the symptom is what we're holding. Let's go down to persistent and excessive concern of harm befalling a caretaker. That's D. Persistent and excessive concern of harm befalling a caretaker. Now, here a lot of colleagues are going to pick D on this exam, a majority, by the way. And the reason they're going to do it is because it is in fact a symptom of separation anxiety disorder. And there are a number of well-known symptoms to separation anxiety disorder. Things like shadowing behavior and school refusal was its own diagnosis once. These are symptoms to separation anxiety disorder. Well, persistent and excessive concern of harm befalling a caretaker is in fact correct as a symptom of separation anxiety disorder, but it's the incorrect answer to this test question. So this has very important learning for a lot of colleagues attached to the concept of what we're going to cover right now. And what that concept is you have to carefully look at the structure of that question and tie it to the answer. The question did not ask which of the following is a part of separation anxiety disorder or a symptom. Rather, it said which of the following is a requirement. That is driving the correct answer here. It's the word requirement. C is in fact a requirement. Many colleagues, a majority by the way, so if you got it wrong, I want you to know you're in very good company. Typically, between 70 and 80% of colleagues will get this question wrong. Now, and that number, by the way, is closer to 80%. The word requirement drives us to, in a very semantic, specific way, to the answer C. The term polythetic was raised just a moment ago, and polythetic is the kind of listing that the DSM-4 or the TR, they are polythetic listings, meaning polythetic listings are a subset coming out of a larger set of information. The DSM-4 TR will say, in major depression, 5 of 9, you will get a subset coming out of a larger set of information. In separation anxiety disorder, yes, you get a menu that you can have a number of possibilities. So you can see that D, which I call biting the bait as D, that persistent and excessive concern of harm befalling a caretaker, that is separation anxiety disorder, but it's not a requirement. Why? Because in a polythetic listing, it is an option, not a requirement. And that's what I'm referencing to about the semantic value of looking at how to take this test. So often for colleagues, it is not their content. It is not the school they went to. It might be the number of hours you studied. I'll buy into that. And it's clearly learning how to take this test. My hope is that our workshop is really geared to talking about these kinds of concepts. And again, I want to say, my hope is that this will help any colleague who is sitting and taking the time to listen to me drone on this topic. So I want to thank you for your time and attention. I'm going to turn it back to Scott.
Well, Mike, thank you very much. That was extremely helpful. We hope you found it helpful too. If you'd like to learn more about the EPPP or about the Association for Advanced Training in the Behavioral Sciences, you can call us at 1-800-472-1931 or visit us on the web at AATBS.com. Thank you, and thank you, Mike.
Thanks, Scott.